ahead and get started because I know we have a really exciting seminar and I want to make sure we have enough time for it and a little bit of time for Q&A afterwards. So welcome everybody to the Lee Kum-Sheng Center for Health and Happiness seminar series. This very beautiful January day with snow. We are delighted today to welcome Professor Ashley Whillans to give a seminar today. She's Assistant Professor of Business Administration at the Harvard Business School. Her work on time, money, and happiness has gotten all kinds of awards and write-ups, actually, really interesting write-ups if you want to take a look. Her current research has been looking at the effects of intangible incentives such as time-saving rewards on employee motivation and well-being. In 2015 and then again in 2018, she was named a Rising Star of Behavioral Science by the International Behavioral Exchange and the Behavioral Science and Policy Association. She is actually co-founder of the Department of Behavioral Science and the Policy Innovation and Engagement Division of the British Columbia Public Service. And her research has been published in all kinds of academic journals and featured in popular media outlets, including the New York Times, the Wall Street Journal, and the Washington Post. Her first book, Time Smart: How to Reclaim Your Time and Live a Happier Life, was published last year by the Harvard Business Publishing Group and received all kinds of nice awards, acclaim, and good write-ups. So lots of good things to follow from Dr. Whillans, and we're really excited to hear your talk. And then just on the housekeeping things, so I think we're going to have the talk and then we'll invite people for Q&A. And I think, Jamie, you're managing, who's managing? Am I managing the chat? Vish, who's managing the chat?
Jamie is managing, and she will read the question. She'll provide the questions to you so that you can
Okay, so then I will moderate the questions to Dr. Whillans because it's always hard to do that when you're actually driving the PowerPoints and stuff. So put your questions in the chat as you have them. We'll collect them and then put them forward at the time for Q&A. So with that, I'll hand it over to you.
Perfect. Thank you so much, Laura and Vish, for having me. I'm looking forward to the conversation. I'll try to keep the presentation not right up to the top of time so that there's ample time for Q&A. So I'm looking forward to presenting some of my more recent work looking at alleviating time poverty among the working poor. So this research project was accepted before the results were known as a pre-registered report at Nature Human Behavior and was conducted in collaboration with my colleague at UCLA Anderson School of Management, Colin West. I'd be also happy to entertain questions about the pre-registration process, given that I think we went through 4 rounds of review just on the methods alone. So I'm really, really interested. If you have questions, I'm happy to chat through that process. So most of my research focuses on the intersection between time and money decisions, and more broadly, how the decisions that we make about our time can affect our subjective well-being. When I'm thinking about subjective well-being, I take a social psychological approach. So I'm really looking at overall life satisfaction, the extent to which people can kind of step back and think about their life as satisfying overall, as well as the extent to which people experience positive and negative mood on an everyday basis. I take a composite measure of overall life satisfaction and mood and use it as outcomes in my studies. So that's just the way that I conceptualize and think about subjective well-being. I think it's helpful. I'll use those subjective well-being, happiness, and positive affects somewhat interchangeably throughout the talk. If I'm only focusing on one outcome, I'll also measure that as well. So this is really where most of my research and my lab's research focuses, is how do the decisions that we make on an everyday basis around time and money shape our subjective well-being. So I'm first going to just briefly overview a little bit of my research on this topic and then talk about this new project looking at how organizations and nonprofits might be able to alleviate time poverty and time constraint with potential downstream implications for subjective well-being, particularly among those who are both financially and temporally constrained. So there's been a lot of research showing that, and I have some Gallup poll data, which I'll share at the end of the talk, showing that stress and feelings of being overwhelmed by the demands of work and life are on the rise. So despite the fact that time diary research suggests we have more discretionary time available to us than we did in previous decades, more working adults, both in the US, but also around the world, report feeling increasingly stressed for time. Like they have too many things to do and not enough time in the day to do them. My colleagues and I have kind of documented I'm just going to see if I have it on a slide. Maybe I don't. Documented that this feeling of time stress can have negative implications for subjective well-being. So in one data set of 3 million Americans, we found that 80% reported feeling time poor, and these feelings, the psychological feeling of being overwhelmed by the demands of work and life, had more negative downstream consequences for subjective well-being in these data than being unemployed. So I've really started to look at how the daily decisions that we make on an everyday basis, such as consumer choices when we used to travel, about whether to take a direct flight versus an indirect flight, and more major life decisions such as choosing where to live, have implications for our subjective well-being via our objective time use and also our subjective feelings of having enough time. So in some of my early research, I found evidence for this idea that both people who focus on time over money, so seem to prioritize time in the context of their everyday lives, report greater subjective well-being, in part because they feel less burdened by the demands of work and life. And then I've also kind of looked at this question of whether actually giving up some of our discretionary income to buy time might improve subjective well-being, in part by leaving us with more time to connect with our friends and family. And I'll share kind of specific results on that in a second. So one reason that prioritization of time is a life value, but also the decision on an everyday basis to give up money to have more free time, promotes happiness. One mechanism we've observed in the data thus far is people report spending more quality time with friends and family, and are also volunteering more and engaging in otherwise active leisure activities that are associated with greater happiness. We also see that giving up money to have more free time, as well as prioritization of time over money, can protect against these feelings of being overwhelmed by the demands of work and life. So we see in some nationally representative data in the US, but I've also replicated this in other countries, that these feelings of time stress usually have a negative association with life satisfaction, but for people who are very deliberate about giving up some of their discretionary income to have more free time, and people who generally prioritize time, that link is not observed. So we do see some kind of pathway effects suggesting that giving up money to have more free time can protect us against time stress impacting our life satisfaction. And these, of course, all of these results hold for covariates that might otherwise explain this relationship. We also see that buying time, making time-saving purchases protects against work-life conflict on relationship satisfaction. And why I'm presenting these results will make sense in a second as I set up this next step. So one thing when I was, doing this research over the course of my dissertation and when I was on the job market, got a lot of questions about, well, what's the relationship between the ability to buy time and subjective well-being, time stress, and income? And so we basically observe a quadratic pattern in the data. People who are financially constrained and who don't make very much money often report feeling the greatest time stress, which negatively impacts well-being, more than kind of middle income earners. High income earners also experience a lot of time stress for different reasons, which I unpack in other papers. But we do observe that in a consistent trend I was seeing in my data across dozens and dozens of data sets is that lower income individuals, people who are struggling to make ends meet, are more time poor. They have more demands on their time. They might be more likely to be single parents. They might commute further to their places of employment via unreliable public transportation. And they just have tend to have a lot of perceived demands on their time, to the extent in my data, my correlational data, that lower income individuals kind of below the median average in my data were making time-saving purchases. This seemed to protect them more, suggesting it was more beneficial. They had less discretionary income, so they were making these purchases less often, but they did seem to benefit more when they actually made them. So this really led me, these correlational data got me and my collaborators thinking of, and there's some research on this by Cass Sunstein and others talking about the importance of organizations thinking about not just alleviating financial constraints, but alleviating ordeal costs. A lot of social services, health services involve a lot of waiting, a lot of time costs that can sometimes go overlooked and might be disproportionately disadvantaging those who are struggling to make ends meet. So these correlational data, together with some of the work on ordeal costs, friction costs in the development economics literature, got me and Colin thinking whether nonprofits thinking about alleviating time poor might improve the well-being, particularly among those who are both financially and temporally constrained. So we really set out to develop this project, trying to provide causal evidence, more policy-focused evidence from some of the work that I had been doing previously. We know from the psychological and economic literature that, and really across disciplines, that poverty is linked to lower well-being and greater stress. It can impede cognitive function given limited bandwidth of managing day-to-day demands. And it also, not only financial constraints obviously involve material constraint, but they also involve a shortage of time. So there's been some time use data, and we've done a lot of research on this topic showing that when people who are financially constrained tend to engage in long hours of unpaid work and have no choice but to do so. And that time poverty is, as others have called it, Indira Hirway in particular, a tax that severely affects low-income women and working mothers, particularly those living in developing markets, where there might be strong gender norms about who is responsible for the childcare and chores, but also less access to market services that might alleviate some of these time constraints. So for example, in sub-Saharan Africa, where we ran this field experiment, women spend an average of 4.2 hours on unpaid work each day. This is on top of working full time. And yet there is an assumption in some of the literature on ordeal costs that people who are cash poor are time rich. So many aid programs seem to neglect time costs placed on recipients, again, kind of consistent with this idea we need to be thinking about alleviating friction. And so there's research in the development economics literature, which I alluded to, suggesting that actually aid programs will build in ordeal costs like longer wait times as a way to effectively target low-income households. So in contexts where it's unclear who makes more money than others, given the informal labor markets that exist, organizations put into place longer wait times as a way to see who's most motivated and committed. There's data suggesting this isn't always effective and can actually reduce the uptake of aid. And there's a whole host of reasons why time neglect occurs. We do this in our own life. It's very difficult for ourselves to prioritize time over material endeavors. There's this pervasive belief that people who are materially poor have a lot of idle time. And just psychological biases exist that lead us to undervalue time, especially under resource constraints. So even in my data under economic uncertainty, people are much more likely to prioritize money at the expense of time, regardless of how much money they have in their savings account. And there's also just a lack of time use data among the working poor. And so Indira Hirway talks a lot about this, and it's something that I'm passionate about in my work, is trying to understand the lives of working women living in developing and informal labor markets to a greater extent, and including time use and well-being measures in these analyses. So this is just some evidence that the policymakers we've surveyed at the Harvard Kennedy School and at the UCLA Anderson School of Management and their policy school, they do actually think that cash is the preferred way of helping individuals in our particular field context as opposed to time. So 87% chose cash from a list of options. We've also replicated these effects in a more open-ended context as opposed to thinking about time-saving aid. And so we're going to suggest that reducing time poverty might have overlooked benefits for subjective well-being, stress, and relationship conflict, really following from some of my work done in more weird contexts and Western industrialized contexts where I've collected data before. There's a little bit of evidence from the Indian Development Survey suggesting that women who own cook stoves, which saves them time on a regular basis, report greater health and have higher incomes. But of course, this data is correlational, so it's not possible to rule out that they also have higher status in society, maybe less traditional households, and that's actually a structure which is actually driving the well-being and health effects. And so we wanted to provide a causal link test of the question of whether alleviating the demands of work and life via time-saving vouchers, and now in some of my new work, time-saving technology causally improves well-being for working women in the context which I'll tell you about. Again, like I said, I have some initial evidence. I have one study, experimental, showing that providing working adults in Canada with a $40 payment and telling them to spend it to save time causally promoted well-being and reduced these feelings of time stress as compared to a material purchase, that spending that same amount of money on a material purchase. But this, of course, doesn't answer this broader policy question of what happens when you implement time-saving aid in a context where working women are experiencing financial and temporal constraints. So to address this larger question, we went to Kibera, Kenya, where we have an implementation partner that we had worked with previously. Women here face significant material and temporal constraints. They complete 42 hours of paid work per week, about 36 hours of unpaid work per week. They also make about $1 to $2 US per day in our initial pilots. And there are, so this idea of services that save time are not unusual. We wanted to make sure we weren't importing an idea from my previous experiments conducted in Canada and the US to this context, which as a brief context, sorry, I missed this detail. Kibera is the largest informal settlement in East Africa, has somewhere between 1 to 2 million inhabitants, and it is an informal settlement. So it's not kind of connected to Nairobi directly. We did see in our pilot data, so we ran the study over 3 years. The first year was a pilot, the second was a larger scale pilot, the third we scaled. In our initial pilot data, we saw that women that owned vegetable stands and were entrepreneurs would pay other their neighbors' kids to go to the market for them in the morning so they could spend more time at selling. So there was already this idea, and Kenyans are very work focused and entrepreneurial. There is this already was this idea around spending a bit of money to earn more or to save time so one could potentially earn more. So this was something a lot of the women were already doing, but many of them couldn't afford to do it on a regular basis. So laundry and meal services, restaurants, laundromats were prevalent in Kibera, yet many people did not use them on an everyday basis. And similar to data that we see in North American context, they also seem to undervalue the time saving. So we also undervalue time saving. If I run these willingness to pay studies, it takes about, in the US, it takes about $120 of a time saving purchase, like a house cleaning service, to be equally satisfied with about a $60 cash payment. And we see a kind of similar separation here where the maximum willingness to pay for time saving services valued at $10 US was about $6 US in the sample. So it was available in the market, there was interest in it. The women in the sample were financially constrained, not doing it on an everyday basis. So our randomized control trial setup was as follows. We had a pure control condition, which was just a show up fee for completing the surveys and going through the study, but women in the sample did not receive any kind of aid. We had an unconditional cash transfer condition, which is thought to be the gold standard of economic development initiatives, of $5 each week over the course of 3 consecutive weeks. This was sent via mobile phone payment, so very easy, frictionless process. And then the vouchers for the time saving services, which I'll explain in a little bit more detail. So we randomly assign women to one of these 3 conditions. And we chose the time saving vouchers to be either meal preparation or laundry based on extensive piloting. We didn't want to we didn't want to remove any positive experiences from one's day. My early pilot data suggests you really want to be removing a negative chore that doesn't have any positive externalities to alleviate burdens to the greatest extent. So in one example of our pilot data, women wanted a garbage disposal, like they felt very unsafe going to the dump. This was something they wanted to outsource to someone else, but it was actually a key point of social time for the women in this community. So we chose not to outsource that particular chore, even though they rated it as very high in terms of stress and something they really disliked, because it was also like a fundamental bonding activity. So we went with things that were kind of uniformly disliked, that most people said they wanted to outsource and weren't creating any positive externalities like a social connection opportunity. So we ran the study through our implementation partner called Kibera Town Center. So this is a nonprofit right in Kibera, right kind of in the entrance of the informal settlement. This was built over the last 5 years. It has a restaurant, some computer labs where we actually ran our studies, our baseline and end lines, a restaurant underneath, and also a laundromat. So it was very good timing. We were actually thinking about starting our own laundromat and restaurant in Kenya to implement the study, but we managed to find a nonprofit who had got there first and had the same idea. They were trying to make working women's lives easier in this location. So our full experimental design, we had our baseline well-being, stress, and relationship conflict measures. We randomly assigned women to one of 3 conditions. And then we had our follow-up at week 6. We also had weekly phone calls as well. We did, again, pre-register the study. So we had 3 pre-registered outcome measures, subjective well-being composite, perceived stress and relationship conflict. We hypothesized that time might have a greater benefit for all of these outcomes as compared to cash, and that both time and cash would be the control. And we pre-registered our analyses. We terminated the data collection slightly early, which is okay because we can't run the study anymore given the current pandemic context, but we almost reached our target end. Just a little bit on eligibility. I don't want to spend too much time on this. It was important they were working moms and had 1 school-aged child because that helped with keeping women in our sample for the full amount of time. This is a highly volatile sample, and as a function of that, they move a lot. So we wanted to reduce attrition. They had to spend at least 3 hours cooking and doing laundry each week and have less than 7 members living in their household so that the aid we distributed would be beneficial and would actually provide a full meal, for example, for the family. So if there was too many members in the household, women were excluded. Everyone had to have a working cell phone, but that is true of 99% of the population in this in Kibera. So this was also not a major exclusion criteria. This is a busy table, but you'll note that there's actually a lot of single mother households. So only about 60% were married or cohabitating. There was quite a high percentage of widowers and a high percent of women who manage their finances. It's important cultural context to keep in mind, given that we're thinking about running similar studies elsewhere where the gender dynamics and the norms in the household are quite different. But here women are quite independent, mostly a lot of female independent households in the sample. And again, relatively high stress. So you can see high SETD scores on a depression scale. So this is a chronically stressed sample. Women in the sample were expressing incidents on a weekly basis, like losing someone or being in the hospital. So it's chronically poor, chronically stressed sample. Just to show you kind of a few manipulation checks, we had a pretty good rate of inclusion in the study. Only about 7% did not return for the end lines. And then there was no between condition differences. So random assignment was successful. There was no between condition differences on any of the demographics we measured, and no evidence for differential attrition, both across treatments, but also on demographic characteristics. So the studies are balanced and there was no differential attrition by demographic characteristics. So to show you the results, so we actually don't see kind of any condition differences at time 2 adjusted for time 1 across conditions on any of the outcomes that we measured. I'll unpack these results in a little bit, but just our pre-registered analysis predicting time 2 subjective well-being, stress, relationship conflict by condition assignment showed no significant effect of differential effect of condition on any of the outcomes that we measured. And this was true. So we also had an additional time-saving condition. We weren't sure if just removing the burden of unpaid labor versus removing the burden of unpaid labor and asking women to plan what they would like to do with their time was going to drive the effect. But we had 2 time-saving conditions, one where they were thinking about it as a time-saving condition, planning what they were going to do with that time versus just receiving meals and laundry. We didn't observe any differences between those 2 conditions either. If anything, there was a slight negative effect of the planning condition. We think in part because it highlighted all of the constraints that these women had on their time. So they felt like they weren't actually able to follow through on their plans and goals that they had set for themselves. And we're currently running some follow-up studies to try to explore that. Though they weren't strong, significant results, but there was a bit of a trend that planning actually seemed to undermine the benefits. We didn't see any individual differences on education level, but we did see that the cash transfer condition benefited entrepreneurs more than time. So this was interesting. There's some literatures which sort of try to think about what kinds of benefits might be most advantageous for entrepreneurs. And we really see, so the blue line here is the cash, we really see cash among business owners really driving the subjective well-being benefits at the end of the study as compared to time saving. So we saw no lasting effect of UCTs or time saving condition. We did see some kind of follow-up analysis. In our follow-up analysis, we saw a bit of heterogeneity. So we saw that time was more likely to bolster time 2 well-being when women spent more time working, more time on unpaid labor at time 1. So for women who are feeling particularly burdened by their chore load, these women seem to benefit most from the time saving vouchers as compared to the cash transfers. When women spent more time working and less time engaged in passive leisure in the time saving condition, this also seemed to promote the benefits of the time saving condition. So it was especially likely for women in the time saving condition to reap subjective well-being benefits when they were able to directly substitute some of their free time with work. But overall, entrepreneurs, just looking at that subsample, seem to benefit more from cash. And also that when women experience greater chronic stress at time 1, it did seem that time seemed to be less effective than cash, potentially attesting to the fact a lot of the stress in this sample is driven by financial constraint. Now, on a more positive note, so the analyses I was just presenting were looking at between condition differences at end line, but when we look at the benefits across all conditions for all 3 DVs, we actually see significant benefit of all 3 conditions on subjective well-being, perceived stress, and relationship conflict. So although there's no differential treatment effect between the conditions, all conditions here are having a significant lasting effect on subjective well-being. So just as an example of this graph, all of the outcome results look like this, but I'm just presenting positive affect changes over the course of the study as an illustration. So you can see at baseline, they started kind of below 0 on net affect, so positive affect minus negative affect. And then over the course of the study, PA is increasing. Week 5 is the last treatment. And then after the treatment is taken away, week 6, there's still a persistent difference in positive affect. So the difference between baseline and end line is significantly different. So of course it's higher during the treatment weeks when women are receiving phone calls and surveys, money, cash, time, but the treatment effects of all conditions are persistent after end line, or after the last treatment is given rather. We also saw some indirect path analysis. So although time and cash both seemed equally effective in these data, they seem to be successful for different reasons. So we saw that the time-saving vouchers increase well-being when they reduce the perceived burden of unpaid labor and reduce the desire of wanting more time in the day. These results are consistent with some of my earlier work in North American context that time-saving purchases seem to have benefits for subjective well-being by reducing time poverty, this feeling of having too many things to do and not enough time in the day to do them. We also saw that cash differentially affected well-being through the reduction of perceived stress of not having enough money and providing women rather with more money slack. Very interestingly, the cash benefits are not driven by objective changes in consumption, not driven by what women were spending or investments. Really, the well-being benefits were driven by the subjective feeling of having more slack in one's budget, not about any objective changes that we were tracking over the course of the study and its expenditures. And that's similar for time. So the well-being benefits are not uniformly being driven by the women changing the way they spend their time, but rather changing the way they feel about how much time they have available. And again, this subjective mechanism is consistent with my prior work research as well. So just some takeaways. We see that small cash transfers in our control condition. So again, our control condition was not a neutral control condition completely. So we are seeing a benefit in the control condition of women receiving money to show up to have stable employment over the course of our study via doing our surveys. And so we can also think about the control condition as a small cash transfer of about 2.4% lift of their monthly income. So we see that the control condition or the small cash transfer, these larger cash transfers, that's the true UCT condition, and time-saving vouchers all produced meaningful increases in well-being, reductions in stress, and reductions in relationship conflict for women in this sample. And more research is needed to understand the psychological mechanisms, particularly between the control and UCT conditions. We were not at all expecting women in the control condition who are still getting some payment to demonstrate the same lift in subjective well-being. But there is some research by Channing Jiang and colleagues suggesting that showing up and not just being given money, but being given the opportunity to work for money can have psychological benefit. And this is, they term this workfare. So there could have been some of this going on in our control condition, and more research is needed to unpack the psychological mechanisms behind the significant boost in well-being, particularly among our smaller cash transfer control condition. We also see evidence that targeted interventions, depending on the kind of stress that individuals are experiencing, might be particularly relevant moving forward. There is some limitations. So the time-saving vouchers, women did have to go to Canberra Town Centre to receive the meals and laundry services. So there was some friction. It's not perfect. The time savings not perfectly passed through to women. So that could have undermined some of the possible benefit. And we also saw kind of follow-up measures that would sometimes not happen immediately after treatment. So if we would have been able to do these momentary assessments, we might have seen differential condition effects immediately after people had received either the cash or the time-saving vouchers. And so future research will need to capture more momentary assessments. I'm also now studying larger and more sustained forms of aid. So I'm currently looking at the long-term effects of water collection technology. It saves girls and women about 7 to 10 hours a day in Rajasthan, India. So I have a field project there that's about halfway through data collection. And there we're also able to study intra-household effects. So we're looking at the effect of this time-saving technology for poor families in rural villages in Rajasthan. And then we're also able to survey everyone in the household. So we can answer questions like, does household support shape the well-being benefits of time-saving technology, and does the social acceptability of work shape these for females, shape the well-being benefits? I think this is kind of sustained technology infrastructure that's being put in place. So we're also looking at long-term changes in physical health, long-term changes in crop yield and wealth of these households, as compared to a match control condition that's eligible to receive this water collection technology from a nonprofit, but have not yet currently received it. And this is just some additional detail on that. So we're studying 100 families. We actually have more than 100 now. And I already kind of mentioned this. So we're also looking at spillovers to the neighborhood, and we're running pre-post measures of subjective well-being, time use, chores, and gender norms. This is just some of my field work actually still happening during COVID. It took us a little bit of creative thinking, but our baselines have all, and I think some of our end lines have now been run. I'm also really interested in trying to understand and measure the value of time subjectively. So most of my research thus far has focused on self-report, but I'm very interested in looking at what factors shape or how we can develop measurement tools that rely also on objective measures. So we're currently developing an incentive compatible measure of the value of time. We randomly assign ping people at random times of day for random payment amounts, work that they can do over the phone, and look at when people pick up and for what payment amounts. So already in these objective data, we're tracking about 600 women in Kenya right now, and we can see that around 5 to 6, even very high payment amounts are not something that women will pick up for because they're caregiving, because they're cooking. So we're already seeing temporal trends and are now trying to understand how, whether we can use this measure as a proxy for underemployment, unemployment, burdens of childcare and other factors. So that's an ongoing project that we have as well. I've also been doing research trying to understand disparities in time use and well-being during COVID. So globally, we see on average, women are engaging in more unpaid labor. About 8% more of their days will be spent cooking and cleaning in the upcoming year. So if we were to extrapolate my regression findings for 12 months, and this paper is forthcoming in the Proceedings of the National Academy of Science. And we also see globally that women are engaging in less active leisure and feeling more distracted and less productive. So we're trying to understand what are the role of interventions, like what are some interventions we might be able to roll out at scale and at the policy level, helping workplaces encourage employees to negotiate for more time, recognize time as a real constraint, especially right now during the COVID-19 pandemic, And this is just one example where we put in a really simple policy change. We put in a formal policy in our workplace to tell employees it was okay to ask for more time on adjustable deadlines at work. And we do see a positive uptake of this formal communication around a policy. It basically, we see generally that women are less likely to ask for more time when they need it on adjustable deadlines at work, and the inclusion of this formal policy mitigates the gender difference in some of our data. So we're trying to think and work with companies and organizations to try to implement similar simple strategies to help everyone ask for the time that they need and to reward employees, not just with financial benefit, but also with time. This is just data suggesting it's important because stress is on the rise despite GDP rising all over the world, in the US in particular. And some data suggesting that focusing on leisure and time is an underutilized path to societal happiness. We see countries with a higher proportion of respondents who value leisure over work are also countries that are happier regardless of their GDP. So this just leads me to my last slide where, my data, I've really collected a lot of data on this topic of time and money across and subjective well-being over the last several years. And Cass Sunstein says this as well: time is the most precious resource that people have, yet citizens and policymakers often believe that money will result in greater happiness. And my data suggests it can. So it's not that money's not a path to happiness. I show you in these data that it is. However, we also need to see free time and leisure as a path to lower stress and greater happiness. So I think I've really been focused on and seen a lot of evidence in my data that both time and money are important, critical resources, but we often neglect time in the favor of objective and trackable ways of helping ourselves and helping others, such as via finances. So it's important to consider intangible rewards and time saving as well, in addition to financial rewards. So I'm just going to say a quick thank you and then open up the conversation. So I want to say thank you to, of course, funding at Harvard that has made this possible, including funding from the center here for the Rajasthan project. So I think maybe it's on, yes, here. And then my implementation partners and colleagues, I really couldn't do this work without them. So it's definitely a team sport when you're running large scale field experiments. So I'm greatly appreciative of my collaborators on the ground and at various academic institutions. So with that, I will leave the talk here and open for conversation.
That's terrific. Thank you so much. What a lot of food for thought and things to ponder. And all kinds of interesting questions that this raises. So I think we're going to open it up for questions. People should go ahead and put their questions in the chat box. I do have one. I have my own question, but actually we've got one already in the chat box, which I'll start with, which starts with a thank you for an interesting presentation. And then the question is, I want to ask, to what extent quality and not just quantity is factored into the conceptualization and measurement of time in your studies? Two people may be equally busy or experience the same level of time shortage, but one may enjoy what she or he is doing while the other doesn't. And then a related question is whether spending time on unpaid work is always bad.
Yeah, so these are related questions. I think this is actually part of the reason why I get the most traction in my data so I measure both subjectively how people feel about their time, how much control people feel like they have over their time, the extent to which they're doing things that feel aligned with their goals in life. And that's really like what captures this time affluence, time poverty measure. Is really the subjective feeling that you're spending your time in ways that you want to be spending, that you have control over your time and schedule. And then I also look at objective measures like day reconstruction approaches and ask people like detailed time diaries. How do you spend your time on an everyday basis? And we really do see, as I've indicated from this presentation today, a lot more traction on subjective well-being for the subjective component of how people feel about their time use. So whether they feel like they have a lot of control over their time, they feel like they're spending in time in ways that are consistent with their values and on things that they want to be spending it on, matters a lot more in my data across data sets for subjective well-being than objective objectively how people are spending their time. We do have one paper showing that in general, active leisure activities like volunteering and socializing, on average, like at this category level, seem to promote subjective well-being to a greater extent than passive leisure activities. But I do think you're right. So where there is a gap in this literature in general, and where we have advocated for more work and other researchers have advocated for more work, is really like bringing those two measures together. And so, that's where momentary assessments become really useful, or, a DRM approach where you're asking people, what are people doing? And when they're reflecting on that activity, asking them how they subjectively feel about that activity while they're doing it. There is some data sets. So the American Time Use data set, which I use quite a lot in my research, kind of gets there. It's not perfect, but there is this kind of, you're totally right, that there is this kind of like gap a little bit in the way our measurement tools, like more research is needed to do this kind of work of saying both, what are you doing right now and how do you feel about it in the moment? So that's kind of a direction of ongoing work in this field, but we do really see more traction on the subjective as opposed to the objective. And to your point, absolutely no, like unpaid labor is not necessarily bad, but it does, like, it is disproportionately, we do see in our forthcoming paper that we kind of have to separate at the activity level and who people are spending time with. So in the gender effects I just presented quickly at the end, we have like a 40,000 or it's like 70,000 respondents. And we do see that the most striking difference right now in time use and well-being is women are spending way more time on necessities than men. But the only component of necessities that's negatively predicting subjective well-being for women is childcare. Chores don't actually seem to be to have this negative effect on happiness. And then the question is why? Well, we're also observing that women and men are more likely to be doing the chores together, but the childcare is more disproportionately falling on working mothers, and then that's creating goal conflict because they're not able to do their jobs or keep up professionally, and that's what's creating the stress. So there is a lot of kind of nuance to unpack, and it's not just black and white, exactly as you're alluding to, that these activities are less positive, these activities are more. It does depend on how you feel about it and the extent to which an activity that you're doing feels like it's getting in the way of something else that you wish you were doing instead.
Yeah, thanks. That's really interesting. And it does suggest that this question of like, goal interference or, is going to be a critical component of figuring out which time is the time that needs to be replaced. And COVID is going to be an amazingly rich data set if the data are getting collected right to ask those questions, because for so many people, time is replaced in both good and bad ways, right, with COVID. So I think that's going to be really interesting. Well, I have a question, and I'm happy to entertain other ones if people send them along. Actually, I have a couple of questions, but one of the things I was wondering is, my sense on the sort of, increasingly strong kind of finding about this feeling of time starvation is that it tracks with digital, sort of increase in digital technology and the ability to do everything in a moment. Like I could send you something today. I didn't have to send it 3 days ago because I don't have to worry about snail mail anymore and so forth. And I just wonder if you have a thought on the kind of the role of digital technology in creating time starvation. I mean, we keep thinking it should be saving us, but it feels like it's actually harming us. And I don't know to what extent you've been able to look at that, or if you have a thought on that.
Yeah, I definitely do. So it's a part of the perspectives piece we just talked about, like we just published late last year. So you're talking about technology saves us time. It also takes it away from us. This is known in the organizational behavior literature, the autonomy paradox. Technology is supposed to free us from the office, and now we take our offices everywhere we go. And there has been some compelling work, again, related to goal interference, goal conflict by Jordan Etkin and colleagues at Duke, suggesting, and one of my collaborators worked together in the same lab in grad school, Kostadin Kushlev, who's at Georgetown, suggesting that our technology not only kind of fragments our leisure, so we're constantly kind of being pulled out of the present and into other and so we have actually kind of less enjoyable blocks of leisure time because we're getting constantly pulled by different alerts, but it also creates this opportunity cost around the value of time. So you start thinking about all the other things you could or should be doing. And that creates goal conflict, which perpetuates time stress. So Costa has this kind of compelling set of studies where he just does something really simple. He asks working parents to turn their phones off at a science museum while they're trying to, at a science museum with their kids, and then has one group, same science museum, same Saturday weekend mentality, but to leave their alerts on, and shows that working parents enjoy and get less meaning out of the same experience when they have their alerts on because of the opportunity cost reminders. They start worrying about work, they start thinking about other things they maybe could be doing, and then that worry about work makes them feel like a bad parent. Why am I worrying about work when I should you know, just be focused and present in the moment? So I do think this technology is really one of the driving forces behind this feeling of fragmentation. So even though technology has objectively saved us time, we don't feel like we have more of it. Of course, there are other reasons for these kind of macro level trends in the Gallup World Poll data around rising rates of income inequality that make people feel very focused on, rightly so, on losing their jobs and needing to be constantly responsive. But again, technology, even in that example, is a conduit for you know, this kind of constantly working. So I do think technology is playing a role, especially right now. So we see in our globally representative studies that workers are feeling increasingly distracted, like they have less productive time. Objective data by some of my colleagues suggests the work days are longer, we're having more meetings, we're sending more emails because we're doing everything over virtual, and there's no work-life separation. And technology is completely facilitating that experience, and we haven't gotten proactive or sort of deliberate from an organizational perspective to kind of set clear demarcation for the beginning and the end of the workday that we took for granted when we were going to the office, when we were commuting. That, of course, commutes are unpleasant, but they also serve as a really important transition. So I think overall, and especially right now, technology is both, I mean, enabling us to do what we do, but also is creating a lot of stress for individuals all over the world.
Yeah, and I mean, my personal perspective is it's, you know, made it possible that things can happen on an instant, which makes it harder to ask for delays, right? Because it's like, well, I mean, you could send it now, so you should. And it's not clear that you should, even if you could. But I have another question that's come in saying, I'm curious about if there are large variations in how we value our time. For example, could those who work in a time-based job, for example, those who are paid hourly, value their time more than those who work in a salaried job?
Yeah, so this is a fascinating question. You should definitely, Kelvin, look into Sanford DeVoe and Jeff Pfeiffer's work. Jeff is a tenured faculty member at Stanford Business School, and Sanford is also at UCLA. A lot of the researchers that study the same topic I study, or similar topics, are there. But we do find, like I have evidence on this too, that when you're paid by the hour, the value of your time is chronically salient. And so there's a whole host of implications for that. So they basically show people who bill by the hour are willing to forego leisure opportunities to a greater extent. They feel more pressed for time. So there's also some research in economics showing that as your salary increases, because your time is now worth more money, that you feel more pressed for time, even if you have kind of lower childcare and other demands, because anything that's valuable, there's a heuristic that it's scarce. So there's some pretty compelling large scale panel data showing that the value of time increases as the time poverty at the higher ends increases as your salary increases. Maybe that's due to technological demands. I don't think they've ever kind of looked at that, but it's definitely been theorized that as you move up, you have more flexibility, but then are also of how and where to work and on what to work on, but you're expected to be working all the time. So that's also a contributor, but they have some pretty interesting experimental data, randomly assigning people even to feel like consultants and showing it makes them savor chocolate less in the lab. They're less willing to help others. They're less willing to, one of my master's thesis project was, billing, like this idea of thinking about the economic value of your time made people like less likely to recycle because they knew the recycling bin was outside, but they didn't know how far. So it just didn't feel like worthwhile to them to even like see like how far that like it was while they were working under this kind of billing mentality. So it definitely can pervasively shape the way that we think about time, and as a result our behavior. And Jeff Pfeiffer and Stanford DeVore are really the pioneers on that research question.
That is actually really tragic if it means that you savor chocolate less. I mean, that is.
I know
really...
that was my favorite finding out of all that literature. They're like they were like secretly watching how long students like ate the chocolate, and students who are in this billing mindset are like, chocolate, don't care. Gotta need to make money and be productive.
That's very sad. Well, let's see. I think we might have time for one more question. And I guess if I don't see any in the chat box, then I will pose mine. Anyone want to throw it in really quickly? Vish, did you have anything? Because otherwise I have one. I'm happy to.
You can go ahead.
Okay.
I think you go ahead.
So I was thinking about this, Ashley, in the sense of, you said most people value money more than they value time, right? And so it's almost like you have to convince people that the time is more valuable in order for them to spend their money to save the time. And I was just wondering if you have any thoughts on how do you change that mindset? Like, how do you convince people that actually it's better not to take that extra job or, do that sort of extra bit of work or even take the promotion, right? Because what you give up might be greater than what you get, because I do think that's assuming that you've met a certain threshold of like meeting basic needs and so forth. Like, do you have a thought on how you change that mindset? Yeah,
so we have a little bit of data, and one of my colleagues' papers kind of speaks to this, but there's a couple of things. I mean, especially in North American cultural context, it's very counter-normative to put time and leisure first in countries that have more of a default mindset. So in my graph, like the Scandinavian countries, it's the likely suspects, people you would imagine kind of have social systems designed around work-life balance. It's much easier. But in North American context, it's a little bit more of a taboo, since there's these ideal worker norms of working all the time, looking committed to your job, being constantly responsive that we've already talked about. So we see that opportunity cost reminders, so simply reminding people that by doing their chores or forgoing the opportunity to spend time in other ways that are satisfying. You can't exactly, to the point that came up earlier, it only works if you leave it open-ended about what this something else could be. Because if you start saying work or family, some people want that, some people that's not satisfying. So just thinking about the fact that you could be spending doing something else with that time that's meaningful. Reminding people about the importance of the intrinsic enjoyment of the activity. So my colleague has research showing that we often anchor major life decisions on money and prestige, and we underestimate the benefit of intrinsic value, so how good something feels when we're doing it. And actually the only thing that matters when we're inside of an experience is how good it feels while we're doing it. The rest of it sort of falls away in the background, at least in the studies she's run. So reminding people to think about the time cost and what that's going to mean on a daily basis and granular. We've also had some success at getting people to aggregate time costs across time. So one psychological reason we undervalue time is the costs of money are quite visceral. So you lose out on $5 or $20, you get double charged at your favorite restaurant, and you feel that cost. It feels like a loss because money is tangible and concrete, easy to track. But if you are on hold for a couple of hours, you don't get as upset. It's not until you start losing like 10 or 12 months on a project that you start feeling upset, and that the time cost was unfair. So trying to remind yourself of and aggregate the time costs across time are really important. And then we've also seen that framing, part of the reason that gets in the way people don't choose time is they feel guilty. And so trying to help frame time as a pro-social act has also been effective in our studies. So we've run some time-saving purchase studies and shown that reminding people that by making a time-saving purchase, they're able to be better parents, have more time to spend with their friends and family, just kind of that it helps them give back to things that they care about, made people show greater intentions to actually follow through on making a time-saving purchase. So you really need to kind of mitigate guilt, legitimize leisure, make it feel kind of like something that's going to help you be more productive or give back in ways that are important to you, as opposed to something that's selfish, which is sort of the default response that people have when they think about this decision.
That's great. Yeah, really interesting answer. And it does make you wonder about the US culture, which is, you know, all about work harder and work more. Like really has no value on leisure time whatsoever. So
there's a reason that 4-day work weeks have not taken off here. Like, even though I know Andrew Barnes, who runs the 4-day work week initiative, quite well. And we've had some conversations and I'm like, yeah, I don't know. Like, I think people here like the idea, but would never do it. Like,
right. Too much guilt. Too much
you can't
guilt.
even get people to take an hour off in the evening from email. So
yeah, but I want to say, I think this is really, really fascinating research. And it does, you know, when we think about sort of what are the kind of social and structural determinants of well-being, it seems to me time is relatively underappreciated, but something we should probably pay much closer attention to, certainly than in public health, you know, than I think we have. So, you know, we will, of course, be watching your work carefully and see what we can do to kind of, you know, pull it in a little more to the discussion. So I want to say thank you so much for a very interesting and provocative talk and set of ideas. And I hope others found it so as well. And we have another seminar series next month, another seminar in our series next month as well. And we'll hope that many of you can join us for that too, and look forward to seeing you then. So thanks everybody. It's great to see all these folks.
yeah, thank you so much for all the great questions. Take care.
Okay, bye.
Bye.